This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor. Welcome to
Healthcare Snitches. So an abortion is also called an induced abortion. So it's pretty much a procedure to end a pregnancy. So there's two different types of abortions. One is a medical abortion, and that is the one where they use medicine to end an undesired pregnancy. The medicine helps to remove the fetus and the placenta from the woman's womb, which is the uterus. It's also known as the abortion pill. Have you heard of the abortion pill before?
Mm-hmm.
Right. That's what they call it on the streets. The second one is a procedural abortion, and this procedure involves dilating the opening to the uterus, which is the cervix. Mm-hmm. That's probably the one where they use those two sticks that they put in there. Mm-hmm. And placing a small suction tube into the uterus. Suction is used to remove the fetus and all related pregnancy material from the uterus. So just don't get it twisted, guys. An abortion is not the same thing as a miscarriage. A miscarriage is when a pregnancy ends on its own before the 20th week of pregnancy.
But just to add to this, you may see in medical claims and terminology it called an abortion, even if it is a miscarriage. You're gonna see, like, let's just say you happen upon a bill from your insurance company.
That's true.
It may say abortion just because they're all falling under the same umbrella.
But I've seen it say medical abortion specifically.
Okay.
Yeah.
So it really just depends on what coding they use.
You have anything else to add to what I've said thus far? I was going to go into the reasons why the procedure is performed.
Okay. Yeah, I do have things to add. So I think one of the common misconceptions is that, and one of the things that got Trump elected is people think that there's all these women having abortions in the second and third trimesters of their pregnancies. Like, people are aborting full-term babies. No, that is not what is happening. Okay. I had a percentage. I don't know.
There's a percent here.
That's not it. No, this is saying 63% of abortions are medication abortions as opposed to the procedures. Yeah.
Okay.
That's what that is. But I should have been more prepared, and I apologize. But 93%, so the folks that do the research on abortion, so there are two main entities that do the research, really. It's the CDC and then another institution. And they do it every 3 years. So the last time they did this was in 2021. And so during that research and data collection, it was found that 93% of abortions occurred during the first trimester. And that is at or before 13 weeks of gestation. So there were 6% that occurred between 14 and 20 weeks, and about 1% that occur after the 21 weeks. Yeah. And usually when it occurs after that point, it's for a very good reason.
For a medical reason.
Right. Either for the mom or for the child, right? So usually, for those of you who are not familiar with pregnancy, at your 20-week appointment, you go through and you can find out the gender, you can find out
they do the
whole organs, anatomy they stuff. Do the whole anatomy scan, make sure that everything is growing appropriately. Sometimes at that time they find out that things are not progressing the way that they should. So maybe the heart is missing something,
the knee bone connected to the neck bone.
Right. Something ain't right. Something ain't right? So they could usually see it at that time because everything is forming. It's really at a good measurement, and you can really see it through ultrasound. Because remember, it's really only through ultrasound that you can see these things. Sometimes you can detect fetal abnormalities via genetic testing if it's something genetic, like trisomy, whatever the numbers are.
21.
Yeah, you can. 21. You can get you can get that information there, but most of the time you get it from this scan. And so if you find something at that time where the quality of life will not be good for the fetus, some people do make the choice to terminate.
Mm-hmm.
Yeah.
Yep.
So that's why it's only 1%, because at that point you're really attached. You don't want to.
And a lot of women don't.
Yeah, you don't want to. You want to go through with everything.
Mm-hmm.
But not if it's going to mean that they're not going to have a good life. So,
yeah. All right. So some reasons why this procedure is performed is a personal decision was made not to carry the pregnancy. And as you mentioned earlier, that personal decision may be taken from women. Mm-hmm. The fetus has a severe birth defect or a genetic problem, which you already mentioned. Mm-hmm. Your pregnancy may be harmful to your health, which you kind of sort of also mentioned. And the pregnancy resulted after a traumatic event such as rape or incest.
Yep. So I have some statistics on that too.
Okay.
So to just piggyback off of what Kim just said, the instances where it was rape or incest was 0.4%. Risk to the woman's life or major bodily function, 0.3%. Other physical health concerns, 2.2%. Abnormality in the unborn baby, 1.2%. And elective and unspecified reasons, 95.9%.
That's the personal
reasons,
right?
Yeah. So you have to consider that a lot of people after they have an abortion don't even respond to why they had it. I don't, there's not like a reporter outside the abortion clinic like, hey, why'd you do that?
Yeah.
And I don't know if anybody that would even want to answer that question right after they've had it. So I don't know if there's like a national abortion survey that goes out, like the patient experience ones, but I highly doubt that too. So I don't even know where they got these reasons from, but
I don't know.
Or if they just put it into an elective category because they didn't get a response, or because they couldn't put it into the other bucket. Mm-hmm. Yeah. So you have to take that with a grain of salt, but also the elective or unspecified reasons could also be that there was going to be some sort of detrimental, incident occurring, and they decided to do it. Not that they had to, because the baby was going to die, but the quality of life wouldn't have been good. Does that make sense?
Yeah, absolutely. Okay. All right. So some risk that are involved with this procedure, whether it's the medical abortion or the actual procedure. Damage to the uterus or the cervix, uterus perforation, which means that they accidentally put a hole into the uterus with the instruments that they use.
Oh God.
Yeah. Excessive bleeding, infection of the uterus or fallopian tubes, scarring inside the uterus, reaction to medicines or anesthesia, such as problems breathing, which is a possibility with anesthesia, and not removing all of the tissue. So you require another procedure
called a
DNC.
Not dancing to DNC like it's fun.
I'm just really happy that you knew what it was called.
Yeah, it's just getting stuff scraped out. Ugh. I can't.
Yep. So those are some of the risks. And in the state of New York, you can get an abortion up to and including 24 weeks of pregnancy. After 24 weeks, you can still get an abortion if your health or the pregnancy is at risk.
Okay. Oh God. What about the state of New Jersey?
I don't know.
Well, child, that's where we are.
I don't know.
Okay.
But I know some people who would travel to wherever they got to travel to.
Right. So did they ask you like, hey, you from around these parts, or did they just like, come one, come all, get it scraped?
I don't know.
Suctioned and.
And your circumstances probably are foundational to where you actually have it done at. So whether you have it done in like a clinic or the hospital setting, I'm sure.
Well, I think it's all about the timing, right? So when you make your decision, if it's like
in the
ER, you absolutely know it's like, hell no, I'm not having this baby once you find out you're pregnant, right? And then maybe you could go to your regular OBGYN and be like, look, I'm not having this child. And then they'll prescribe you the medicine so you can just have a medically induced termination. And unfortunately, some people don't even know that they're pregnant sometimes. So that's one thing. But then if they do, maybe they're like battling with making the decision and they're going back and forth. So there's a lot of things that kind of factor into the timing of when they make that decision and their options then, right? All right. So, so the next thing I wanted to talk to you guys about is Project 2025. All right. So one thing that I want our podcast to serve as is a platform for helping you guys understand what's coming down the pike with Project 2025, this administration, how you can protect yourself. And I do feel like our services in terms of our consulting and patient advocacy is going to become critical.
A necessity?
Yes, because he is putting RFK Jr. in charge of the Health and Human Services, right? So this is someone who is walking around saying that fluoride causes autism and that he's going to remove it from the water. I don't really know any of the other things that he said, but what I do know is that
he said a few foolish things that made no sense.
Yeah. So we have to be vigilant, and I just got like, we need to prepare ourselves. So one of the portions that's really deep in Project 2025 is reproductive rights. So I did want to just, let you guys know what they're trying to do here. So I'm just going to go through this briefly because we have a guest that will be joining us to talk about some termination stuff. All right, so the first thing that Project 2025, at least as it's written now, right? So we don't know what they plan to, or how they plan to implement it. So that's the other thing. Like, they could make this way worse or what have you, but just like, these are the things that they're planning for us. They want to end medication abortion. So 63% of them, like I said before, like we said, the majority are medication abortions. They are trying to limit the drug, the drug that is used for the termination. Yes. So they are trying to end the telehealth provision. So I think right now you can get it via telehealth depending on where you are. They're trying to take that away so that you will only be able to get it at a brick and mortar clinic. So obviously that will impact those who are in rural areas and also those who do not have transportation to get to a clinic to get the pill. They actually want to revoke the drug that's used from FDA approval, and that would remove it from the market entirely. So that's how they plan to threaten the medication abortion. They want to allow hospitals to deny emergency life-saving abortion care to pregnant patients in crisis. So they basically want to violate EMTALA, which
that makes no sense.
I recently watched something where they plan to fine and imprison those who participate in performing the termination. So that goes for the facility, the doctor, and then also the mom that would have the procedure done. So they want to criminalize this basically. I did not read the raw version of Project 2025. I only read like Cliff Notes here and there.
Little Cliff Notes?
Yeah. But from what I heard, you can be jailed up to like 15 years for violating this.
And then you mess around, go to jail, get raped, or start sleeping with a CO and get pregnant in there.
Right. So the answer is to stop sleeping with people because we don't know what.
This is so sad for our daughters.
It's really bad. The third way is they want, oh, here it is. Oh, no, this is different. They want to prosecute people for shipping and transporting abortion pills and supplies. So, do with that what you may. They want to permit extremists to harass abortion clinic staff and patients without consequence. So those people that be picketing outside of that place, they don't care. And they want to establish an abortion surveillance system that forces states to report the intricate personal details of all patients receiving abortion care. That is scary. So I think the thing that they've been trying to say is like, oh, with the overturning of Roe versus Wade, we'll leave it to the states, right? So now, I don't know if you all have seen the map of the states post-election, but it's all red. And there's like blue on the East Coast,
a little pinch of
blue on the West Coast, and like one blue on the bottom. But the whole middle part in between is all red. And so those red states are conservative. They believe that it, just like the motto is going now, your body, my choice. Okay. And so you have to take that slogan very seriously. They really feel like that. It's your body, but it's the state's choice. So, I think one state may have been, was it Florida? Had it on the ballot about abortions. I think it failed. So I watched Handmaid's Tale, like a few episodes, and I got so scared I had to stop watching it because I have anxiety. But
I won't be able to watch that.
I think if you want to understand where we're going, that would be the best thing to watch right now. They also want to undermine reproductive health globally by cutting off U.S. financial support to other countries and other initiatives that we have going on in other countries that provide support for birth control, and contraceptives, other contraceptives.
Let's see it.
I think those are the biggest pieces that impact abortion rights and what we have going on. I also wanted to say that Planned Parenthood gets a really bad rap as being an abortion clinic, but they're quite rarely the place that people go to have an abortion, just to let everybody know that. They have specific abortion clinics, or if you're having the medication, you're just going to your doctor. And there aren't that many abortion clinics nationwide. So there's about like a little over 1,700. So
it's not like it's one on every corner.
Yeah, there's not one on every corner. Like, you got to find that thing. So it's not this widespread thing. Planned Parenthood provides many other services that try to help you prevent pregnancy, actually.
Yeah, that's actually where I went behind my mother's back to get on birth control.
Me too, child. Got right on it. Ooh, if you're watching this, Mom, don't. Whatever, it don't matter.
I feel like we were doing the right thing.
Yeah. So if we come across, anything else regarding Project 2025, or if anything changes, we will do a whole episode on what you guys can look out for, because even though this plan was written, well before he's going to take office, I do suspect that he plans on implementing it, because he's already started with things like, I want to get rid of the Department of Education. And I mean, he's going to do this. And so brace yourselves for this, and you may think, I'm not of reproductive age, but policies like this impact everybody, whether you realize it or not, right? So we have daughters. We want them to have options. When you don't have options, people turn to extreme measures that are unsafe.
Like in the back alley using a hanger for an abortion.
Right. Or, you just have a whole lot of unsafe situations that take place. And it's just not cool.
Okay.
All right, so we are going to have a special guest, and I'm going to let And I'm
Okay.
going to let Kim do a little intro before she joins us.
Yes, we are going to have Chanel on today. Chanel said that she's ready to tell her story. So I have some questions for her. And I'm going to be Gail or Oprah.
I'm going to say, you're Oprah, I'm Gail.
Yeah. So we are just waiting for her to join. And we have to pray for better days.
We do, because quite honestly, it starts with things like this, and then other rights are taken away. And so we really have to be vigilant about what's taking place within our government. Now, we already, the country has already elected him, so there's nothing we can do about that. But we can try to fight against what's going on for our own good.
All right. I'm barely in the camera, but hey, Chanel, how are you?
Hi, I'm good.
Thank you for joining us. Welcome to Healthcare Snitches.
Thank you for having me.
Me and Jasmine got to be like this,
Oh,
because you taking up all the spaces.
sorry.
Okay, so the first part of our episode, we were talking about abortions, the different types of abortions, how things are going to be impacted by our new president that we have in office, and I just have like a lot of questions for you as far as abortions go.
Mm-hmm.
Do you want to start? Do you want to say something first before you start
Say
asking
something
questions?
like what?
I don't know. Like, my name is Chanel, and I'm here to say, I don't know.
She's a rapper today.
I am.
Oh, okay.
Do you have a rap that you want to say?
No, not a rap. Like, any introduction. Okay.
No,
Right.
hi, my name is Chanel, and yeah,
And you're here to tell your story?
that's it.
Chanel, how old are you? If you
I'm
don't mind.
32.
32. Okay. And how old were you when you had an abortion?
So I've actually had two in my
Oh.
32 years of life. So I was 18 when I had my first one, and then I was 30 when I had my second one.
Oh, I feel like my pre-episode interview would have told me that, but I'm sure that you probably did tell me that before. It probably went over my head. now that I know that you had two, my question is, did you have the support of your parents in both of those situations?
So my first one, I didn't tell my parents at all. My mom actually found out from the picture of the sonogram that they give you years ago.
Mm-hmm.
And she found out and said, well, why didn't you let me know? I would have definitely supported you with whatever decision that you wanted to take. I would have helped you. And then the second time, my parents was completely on board, and they definitely supported me in whichever decision I decided to make.
Okay.
Can I ask a question? Well, are there any questions that you don't want me to ask?
No.
I already answered that. She said nothing's off limits.
Okay, so the situation when you were 18, were you in a relationship with the person? Was it just kind of like a...
I was in a relationship. We were in a relationship for 5 years.
Oh, okay. Since you were 13, so he was like your first love?
Pretty much.
You just felt like you weren't ready at that time.
Right.
Yeah.
Okay. Did anyone try to talk you out of it or into it either time?
So the first time I was actually working, I was doing summer youth, and I was working at Walgreens, and my boss had came up to me and she said, "Can I ask you a personal question if you don't mind?" And I said, "Sure." And she said, "Well, are you pregnant?" And I said, "Yeah, how do you know?" And she said, "Well, you're one of my fastest workers here. It never takes you all day to just break down a shipment. And every time you touch a box or a carton, you have to sit and you're taking a long period of time." And I said, "Well, yes, I am." And she said, "Well, what are your decisions? Like, do you mind if I have a conversation with you? Did anybody talk to you? Like, what is your parents saying?" And I said, "I didn't tell anybody. I don't know what to do. It's just kind of been in limbo in my mind. Like, the only person that knows is my boyfriend at the time." So she said to me, "Can I give you like some advice?" And she said, when I was going through like younger and I was pregnant, I didn't want it. And I had somebody that came and spoke to me about the situation. And they said, you have to wait until you find the right person. Like, you don't want to do that. Like, you have your whole life ahead of you. You can go to college. Did you think about that? Like, you don't want to struggle and give up your lifelong dreams just to have a baby at a young age. It may be cute, but then what are you going to do? Like, do you want to be like me, working at Walgreens, aspiring to be a Walgreens supervisor? Like, that's not what I have or I see in your future. So she was like, if you want, can I continue? And I said, sure, I appreciate the advice that you're giving me. She said, I wouldn't get too attached with the idea of having a baby. Don't get sucked into it. It's not, it's cute, but detach yourself. And she gave me Planned Parenthood, and she said, you can go wherever you want to. I chose not to go to my borough, which was Staten Island, and I chose to go to Brooklyn's Planned Parenthood. And when I
The
went,
one that is downtown Brooklyn?
yes,
Mm-hmm.
they were very friendly. Me and my boyfriend had went, and they gave us all the options. They said you can have the choice of delivering the baby and giving it to a family that really wants a baby of their own. You can do the pill abortion. You can go do the surgery. And I was pretty early in that pregnancy, so she said to me, so we chose the pill.
Mm-hmm.
Unfortunately, the day that I had set to take the pill, he had to go to work, so I kind of went through it alone at home.
Oh.
So that was that time. The second time, I was actually forced into the decision because I was already working. I had enough saved up. I already finished school. Um, I really didn't have any plans to continue my education. I was pretty content at the time.
So you had your bachelor's, but not your master's yet.
Right.
Mm-hmm.
And um the person I was with, we weren't together in a relationship. It was more of like a situationship. And I automatically knew when I didn't have to pee on the stick. I just automatically knew. And I said, I texted him because my gums was bleeding. And I said, hey, I've never had bleeding gums. Like, it hurts. Just for
Stomach bug.
confirmation, I peed and I was like, I'm pregnant. So he said to me, he didn't want it. He automatically left work, drove, and was really trying to talk me out of it. Um, then when he found out like the answers that I was giving him, he didn't really like. So he gave my number to his mom, and his mom started calling me and saying like, I can't deal with this. This is not it. I don't even know who you are. You shouldn't be.
Well, my
Um,
thing is, if you didn't want to deal with it to him, why were you hitting it up? Okay, hitting it up like that. You know what
right,
I'm
right. So these were a lot of the questions that I had after, so then I reached out to my mom, and my mom was like, if that was the same things like you said, if that was the case, then why were y'all doing it things unprotectedly? He kept saying like he had a daughter already, and this is not
So
what.
you were good enough to have unprotected sex
Right,
with, but you were not good enough to bring a child into the world with.
Oh
right.
no.
Okay.
Yeah, I wouldn't want to have a child with someone like that at all.
And that's exactly what my mom said. And she said, you wouldn't want to bring a child into the world with somebody like that. Like, look at the issues you already have. And you just found out. So it came down to my mom was kind of siding with not keeping it because
Mm-hmm.
the issues that already started to be, foresaw. And my dad was like, I don't want you to go through this. Like, you're already old. You're older. You're getting older, and it becomes more complicated as you get older. So I'm willing to step in, have him sign over his rights, and we can take care of this together as a family. You have full support.
Wow.
No, her dad is amazing. That's her BFF.
Yeah.
So you had um different points of views, different types of advice, different wants and wishes, but
Yes.
it all boiled down to you making a final decision.
Yes.
Okay. All right. My next question. Did you have any health issues at that time that would make you think that you could not carry a baby to term?
No.
So that was never an issue.
Never.
You always felt like you could do this. Okay. How did you feel about your pregnancy when you made the decision both times?
My first time, I was happy with my decision because it led me to go on to finish school. I finished my associates. I got my bachelor's, and it ended.
No, no, no. Sorry.
Oh, sorry.
Sorry. How did you feel about the actual pregnancy? So, like when you were 18, did you feel like, oh my God, I'm pregnant, I'm happy, I'm going to keep this? And then during the second time, were you like, oh my God, I'm happy, I'm going to be a mom? Like, how did you feel about the actual pregnancy, not about your decision?
Oh, I was nervous. I was very nervous the first time.
Because you were a kid.
I was right, and I didn't know. I was like, I don't know what to do. The second time, I was extremely happy. I was ready. I was like, oh my God, I'm gonna be a mom. I'm ready for this. I can't wait. Um,
And how old were you the second time? I'm sorry.
30.
30?
Mm-hmm.
Okay. Oh, girl, that was just a couple of years ago.
Yeah.
Ooh, child, fix it. Okay. Okay. So you had some disappointment there with the second one for sure.
Yes.
Okay. What was the process of assessing abortion services like for you? So I know that you said that you went to the one in Brooklyn, but was it like any type of research done or any
No,
word by somebody like, oh, I went here?
it was just by word of mouth from my first boss. The second time, I did a lot of research. I had asked my GYN at the time, and she was also on board. Can you stop? She was also on board the second time, and she was like, "You actually wanted this. Like, you wanted to have kids. Like, this was in your future. Why is this happening to you?" She actually gave me a place, which was in Brooklyn, but I also researched myself. I researched a couple of different places. I searched Planned Parenthood again, but this time in Jersey.
Okay.
And Jersey at the time, they weren't accepting my insurance, and they were saying like the whole thing had to come out of pocket,
Okay, so that made it not an option.
and it wasn't an option.
How much was? Do you remember how much they said?
If I'm not mistaken, I think she said about within the range of 500 to 800, which
Ooh,
was the
child.
pill out of pocket.
Damn, we can ask Pookie and them on the street.
See, this is what I'm talking about. Like things like that, you gotta pay 5 to 8. Like, who's gonna be impacted by that?
Right.
So let me ask you. So the first time you did the medication, not to get all deep and
No, that's fine.
I know you said you had to go through it alone, but was it smooth, or did you have to do anything after? Like, did everything like
It
work
was
out?
very smooth. It was very smooth. It was a very smooth process. I had to just wait until the second pill kicked in, because they make you come back and take the first pill in office, see how you are. And the second one you took, I believe, 12 hours after, and you had to make sure that you was laying, made sure that everything was being brought to you, couldn't get up a lot, so that way I guess you wouldn't bleed out and stuff like that.
Yeah.
So it was pretty easy. They told you, like, if you use the bathroom, make sure the bathroom was close by, and just don't look down.
So was it like a whole bunch of cramps? Was it like contractions? Like what was
It
this
was
like?
if well, I wouldn't know what contractions were, but it was a lot of cramping. It was a very heavy cramping and a lot of bleeding. A lot
So
of
were
bleeding.
you able to take like Tylenol with it?
I don't take Tylenol, so I didn't.
Okay.
And how long
did the whole process take?
Yeah.
The whole abortion process take? I want to say it was like 24 to 48 hours. It wasn't bad.
And then do you go back to them for an ultrasound?
You go back.
To make sure everything came out?
Right, but I didn't do that.
What?
Child, you can have some stuff.
Girl, you can have a pinky toe in your uterus.
Not a pinky toe. Not a pinky toe.
So you didn't go back?
No, I didn't go back for the follow-up. After
right. We do not recommend this, people.
No, I really wouldn't recommend that at all. And I was young, so
yeah. Okay. So, when you were 18, it was the pill. What was it when you were
I
30?
actually did the procedure.
Oh, you did the procedure, so you had both sides.
Okay,
Right.
so up in there, they would have caught it then.
Mm-hmm. Yeah, they took out that pinky toe then
Yes.
from 12 years prior.
I'm done.
I wouldn't, if I had to say, I wouldn't recommend.
The procedure.
No.
Yeah.
What is your reason?
So where I went in Brooklyn, they kind of they took away your identity so that way nobody would know who you were.
Mm-hmm.
So everyone pretty much got their
A
names
fake name.
changed to different countries.
Mm-hmm.
And you couldn't have any cell phone service. It was nothing. You was just literally sitting in a room waiting to be called by your country name. And they asked you to sign a bunch of forms, and I'm pretty sure they explained it to you, but my mind was racing a mile a minute because at the end of the day, I 100% didn't want to make that decision. It really was. I only did it because this person was hounding me for it. So, going back in that room,
You don't
getting
need to know who he is, so we can hunt him down.
going back and into the back room, waiting to continue the procedure or whatever. They have everybody sitting in gowns,
Like, oh,
complete gowns, and then they continue to call you by your name. Then you end up sitting in a stretcher. A nurse comes by, she inserts your IV and gives you a little bit of fluids. And I remember her saying to me, "You don't want this." Even the sonogram tech, when they went to go check to see how many months you were, she even said, "I've seen many girls come in here excited, ready to do it. You don't want this."
oh,
She
Chanel,
said,
that's
"We
terrible.
normally do not give the pictures out. We're not supposed to anymore, but I'm going to give it to you."
Oh,
She
Do you
said,
still have it?
"Yes, I have both from the first one and the second one." And when I went back into the room, when they called me, they didn't call me, they wheeled me at this point to the procedure room. The doctor said, "You didn't want this."
Damn, it was that obvious?
It was that obvious.
Were you crying?
I was crying. I didn't like the fact that they had you, I felt like a bat, like hanging upside down, kind of.
mm-hmm.
Feet high up with the stirrups up in the air like this. It was never any, your normal gynecological exam, your legs are down low. The legs were high up in the air.
So, like above your head?
Yes.
Excuse me.
And from there, I woke up. The anesthesiologist was like, "I'm gonna make sure you are asleep for a bit." I woke up. I was a little sore, and they made sure that I ate. I used the bathroom, and then they called him to pick me back up because he was my only ride.
Mm-hmm.
And he just dropped me off and said, "I gotta go hang out with my daughter. I gotta go. Bye."
Wow. Have you seen him since then? Like,
I've
what was the
seen
status
him.
of your relationship after that?
I've seen him after that. He didn't really come by and check up on me. I was so depressed afterwards. I really suffered with mental health after that. It was a very dark period of my life. I took
Mm-hmm.
off a couple of days of, well, not a couple. I took off 2 to 3 weeks of work, and I had enough vacation saved up, so it was fine. I can honestly say how I felt after. If you've ever watched, what is it? The vampire movie with Jacob and Bella?
Oh,
You
what the hell is
know?
that?
Twilight? I've never
Yes,
watched it,
Twilight.
but like,
And when she got depressed and she was just searching for that high, and she learned how to ride the motorcycle. I literally went out and bought a car with my savings.
Oh, that's where you bought
DeMarcus. Yep.
her. Her,
not
her
DeMarcus.
car's name is DeMarcus.
I can't.
Yeah, that is her car's name.
All right.
And after
I love
that didn't really fulfill, like I went out and that's when I went back to school and I got my Was it
Masters.
my master's? And now I'm here, and I feel content to tell everybody, like,
You
it's
feel
not an
love.
easy procedure, and for those who want it,
Wait, you are skipping my questions.
Oh,
I'm saving
sorry.
that for the end.
Oh.
Your advice. All right. Did you face any stigma or judgment from others after your termination?
Yes. So my friends at the time, they kept saying, like, I've done these back to back. I've never felt the way you felt. Like, you're taking this too serious. She was like, no. And
Are there
then
people that
use it as a form
birth
of birth
control?
control?
as a
Yeah,
form of
there's
birth
some people
control,
that do.
yes.
They're like, I just pop a pill and give
I
it
have
this
a
thing.
cousin that does that.
Right.
Well, she
no.
used to back in the day. They knew her name in the abortion clinic.
Oh no! See, that's not cool.
Yes. It was.
Okay.
And what else? I would
They taking it too hard.
Huh?
Are they still your friends? The friends that said
No.
that? Okay,
No.
because they don't sound like your friends. Because you could take it however you need to take it.
Right.
Right. It's you.
They can't tell you how to feel about your womb and your child.
Right. I've actually haven't spoken to cousins because they said that they couldn't really handle my depression at the time, and we're not speaking to this day.
So they turned their backs on you.
Yes.
When you needed them the most.
Yes.
You could relate to them.
Mm-hmm.
I mean, not about the abortion, but about people turning their backs when you need them the goddamn most. I hate people. So you answered a few of my questions that I already have listed here. I wanted to know if the procedure was done in a clinic or hospital setting. They were both done in a hospital setting. You already told, in a clinic setting.
Mm-hmm.
You already told us what your deciding factor was for both of them. Right?
Mm-hmm.
Okay. Any questions you got for her, Jazz? You want to jump in at all?
No, it's just like, thank you for sharing your story. It definitely coincides with some of the statistics that I saw about the ages that people choose to have, where they choose to have the terminations, and it's usually between like 18 and 29, the early 20s for the most part, because that's when you feel like,
I'm not ready for this.
Yeah,
right.
I'm not ready for this.
I'm outside.
And it's usually the majority of terminations are done by unmarried women, as opposed to married women, right? Because it's just different circumstances. So you have different decisions to make in that, and you will have those people that are like, oh, I don't want this. The guys, again, saying your body, my choice, right? So now he's telling you it's your body, but nah, I'm not gonna get down with this, right? When in all actuality, all he has to do is be a dad afterwards, which is like, all dads really do is, they do a lot if they're a good dad. But really it's just about child rearing. You don't have to carry the child, you don't have to birth the child, you don't have to breastfeed them. We do most of the care for them. And so what you're saying is, it is just crappy. I want to say something else, but.
And this guy was already a dad.
Yeah, so
yeah.
No.
Karma is gonna get him.
I hope it already has.
It did.
And it's not. Ooh.
Did you feel different emotionally pre-procedure than you felt post-procedure?
You said emotionally?
Mm-hmm.
Oh.
Yeah. I think it was more of the same. I want to say I was nervous pre-procedure, and afterwards I was extremely saddened. I was extremely sad. And then it just started to decline afterwards, like rapidly, day by day.
I think the fact that he dropped you off and said that he had to go to Dave and Buster's, pretty much.
Not Dave and Buster's.
I think that also contributed to the pain that you were already feeling.
Yes.
But imagine, right? Just imagine if you can find any solace in, if you were to have a child with this person, how they would treat not only you but your child, right? You don't want to have to perpetuate that to another generation. So although it hurts, I'm sure it's gonna hurt until the day you die. Like it just is. Just hopefully you can find comfort in the fact that you just stopped it at you.
I think that
Yes.
you're not in the camera.
It's okay.
Okay. Do you have any regrets, and would you do it all over again if you had to be in that situation?
So if you would have asked me that when it happened, I would have definitely said I had a regret of doing it. As I've come throughout the years, I look at it now as not as a regret, but more of a life saving factor. Like Jasmine did say, how he would have treated me moving forward. That
Mm-hmm.
comes into play a lot. And I would never do it again. I would never do
Okay.
it again.
So if you were in a situation where you were with a guy and he didn't want it, you gonna say, "Deuces, this is me and my baby, and I
Right.
got this." Okay. And I always tell you when we are at work talking, you are such a sweetheart. You are such a good person. You are such a prize for
Mm-hmm.
somebody's son out there, and you deserve so much more than what has been served to you.
Mm-hmm.
So I'm actually glad that you chose what you chose, but I'm also glad to hear that you are no longer going to let somebody else be the deciding factor on if you are a mom or not.
Yes.
As far as the person that you are dealing with, because our new president might decide that for us. But as far as the person that you are dealing with, you will no longer let them decide.
Yes.
But what we're really going to pray for, right now, I'm going to add this to my prayers, is that you have someone that would never even put you in a situation where you feel like you have to question whether you're having that baby, right?
Right.
You want it to be a happy situation where you know I'm pregnant and we're doing this, right?
Mm-hmm.
So whether you're married or not, because that's a whole thing too, guys.
Right.
Like this Project 2025 and this new president, I don't know about getting married, and I also don't know about getting pregnant. But if you're in a good situation, then it could be fine. So I guess one of my impromptu questions is, how do you feel about having kids going forward? Like, do you want to be a mom? Are you excited? Are you looking forward to that? Or is it something that you kind of like scared of?
I do want to be a mom. It is something that I'm looking forward to, but I'm also scared because sometimes in the back of my mind, I think about like what would happen if I did find out that I was pregnant? Would I get that same reaction that I did the last time? Because nowadays, a lot of men like to love bomb. A lot of men like to, tell you what you want to hear, and then when things hit the fan, it's like I don't want to do this. We wasn't really like this, and you know. So that's the most part I'm afraid of.
I rebuke that
Right.
because you are going to make a baby out of love. And like Jasmine said, whether it's your husband or not, he is going to love you and it's going to be a baby made out of love. So we already put that into the
Thank you
universe.
guys. Thank you.
Mm-hmm.
Absolutely.
How did your termination experiences affect your relationships with partners, families, and friends?
So
These are some good questions.
no, that is. Um I haven't really spoken, like I said, to my cousins that I was really close with because they were already starting to have their own family. And at the end of the day, they were like, oh, well, I think they thought like they kind of thought that they were younger than me and they were already advancing and moving forward with their lives. And as I'm getting older, I don't have that as of yet. So I
That's
couldn't
fine.
relate to them in a sense. Um,
Just awful.
a lot of the friends that I did have that had kids, although they were cheering on, like, you're so glad that you didn't have this. In the same breath, they were like, you would have made a great mom. And it was just like, wait, are you really saying this? This hurts right now. Like you don't understand the words. So I think that's where we fell off at. And then it also came into, you don't have a kid, so you wouldn't know how to respond to this scrap to this to these child responses. Like you wouldn't be able to speak on it. And that hurt as well. So it kind of like made me distance myself from people who did have kids. And I wouldn't really say anything. Like I would really just be quiet about the situations.
Okay.
Yeah.
So what about within your current relationships, right? So how does that impact the questions that you ask them, the conversations that you have about, okay, we're doing this. There's a possibility that I could get pregnant. How do you feel about, like, do you ask different questions now because of your experiences?
I definitely do. I did have a recent person I was speaking to, and it definitely did come
What?
in.
Okay.
I'm not feeling.
It definitely it was a topic of conversation. So we kind of had a little mishap, and it came down
What is
to,
up?
well, who was gonna buy the pill, and it kept
Okay.
coming down closer to closer, and then it kind of didn't happen. So, well, no one purchased it, and
Okay.
just sitting there, the waiting game, and he kind of like disappeared and resurfaced after my period came back around, and we had this big conversation about kids and his reservations about it because he already has kids, and it was just pretty
He left.
much, yeah, it was
He
pretty much him
Is
saying like,
somebody that you're still talking to or no? I hope not.
not really.
Okay. Just as a caveat here, real quick, to everybody listening or watching, you want to stock up on your Plan B pills right now, right? Because we don't know what's going to happen next year. All right. So you can get them on Amazon. You can go to the pharmacy,
CVS, Walgreens,
Walmart.
Walmart.
You know,
That's actually smart. What you just
stock
said.
up on them now. You understand? Because we're not having. Sorry, but we're not having these babies. I mean, at least I'm not. Thank you.
No.
Okay.
PSA.
You already told me how the terminations affected your mental health, but how do you think it impacted your self-esteem?
It lowered it by like tremendously. Now I walk around and a lot of people say like, "Oh my God, you're how old? You don't have a kid yet?" And it makes me feel like I'm missing out on milestones growing up in my
You
adulthood,
are not missing out on nothing, girl. Live your life.
and
Yeah,
I'm
because
really
it's gonna
not.
be either, oh, you don't have them, or when I say I have three, they're like, oh, you got that many? So it's like you can't please
You can't
everybody,
please
right? Like,
anybody. Yeah.
what? Who can you
You
please?
don't even look like you have three, right? Or you get that
See?
question.
Yeah, I get that. See?
Did you seek any counseling or support afterwards?
Yes, I went through 3 different therapists. Three
Do you
different
feel like
therapists.
it helped you?
Um, it did. It most definitely did. It came down to the third person, and it was a guy this time, and he was black. I've been through the whole spectrum: white, black, Puerto Rican, Asian. I had them all, and
Okay.
he said to me, "It is okay. It is okay. It sometimes it's a part of life. Not everybody has to go down your road, but it has happened.
Mm-hmm.
Live. You do
Think it first.
not need medication. You need to live."
Well, to elaborate a little bit, one of the previous therapists had tried to put you on medication, right?
Yes,
Yeah.
yes.
Oh, okay.
And this one said she didn't need it.
And he said I didn't need it. I was just going through
Okay.
life, and
He had you on the wrong type of medication
that
anyway.
too.
Oh.
He
Yes,
had it on like bipolar medication.
yes,
Oh, this was a
yes.
therapist or a psychiatrist?
It was a psychiatrist or a therapist?
Psychiatrist through ZocDoc. So be careful when you go through those telehealth visits, and they just look at you and say, "Oh, this is it."
Hmm.
That's awful, Chanel. What are your thoughts on the current political landscape surrounding abortion rights?
In terms of political, what do you mean? Like,
With the decisions that are planned out for 2025 as far as women not having rights, pretty much.
I feel like I'm leaning on your side.
No.
Okay.
um,
And especially as someone who has been through it twice.
I feel like there should be, for those who abuse it, absolutely, it should be taken away. I think it should be it should have stipulations to that rule. If you were, you know, raped or anything like that, absolutely, you should be able to terminate at any given moment of your choice.
Oh, they plan on taking that out of there. Rape in cases of rape or incest.
Oh,
So what if, how would you feel if when you were 18 and you were 30, that your decision would have been made by the government and you would not have had the option?
now if it was at 18, I'd probably be a little bit upset because I realized I had a lot to experience and live by. If it was 30, I'd probably be extremely excited because, like I said, sometimes it does play up on my mental in regards to the milestones that I would have reached. And because everybody keeps talking about biological clocks is ticking, and I don't know when my clock will stop ticking, you know? So it really depends. I wouldn't really be upset.
Okay. And my last thing is, do you have any messages or advice for a woman who may be struggling with the decision to terminate her pregnancy?
Yes, I would say know your advisors on your court. That is the biggest thing I would say. Make sure that the people in your court who advise you are pure, are right, are just, and that they have your best interests at heart. And go with your gut and what you want to do. Don't let anybody else make that decision for you. Because at the end of the day, they're not going to be the ones to hold your hand while you're going through that. And whether or not people believe it or not, but it does play a big part on your mental health. And I'm probably one of the few women who speak up on that. So it's not always easy to go in there and have a big procedure like that, because you might have complications. You might end up dying on that table. You might, I was just lucky. You might not ever survive, and you'll probably sit here with become an old lady with 900 cats, you know? So definitely take it easy when it comes to situations like that. Know your options. Ask questions. Is this a hard no for yourself? If having abortion is a hard no, and the person is like, well, I don't care, I'm not going to do, I'm going to be all free willy, that's not the right person for you, as to what, you've said to me several times, Kim. And be true to yourself. Just be really, really true to yourself, and be kind. Be kind. If I had to take one on my therapist, be kind to yourself. And that means in all aspects.
So don't beat yourself up for this.
No.
I think that men need to take more accountability for the role that they play in this entire situation, right? So, like, most of the time, they are the ones talking us into having the unprotected sex,
Yes.
right? So they're like, what I've learned through, recently being single and on the dating streets, none of them want to use a condom. And I'm like,
None.
I have been like, first of all, pregnancy would be a gift, right? There's so many other things that can, take place before that, like a disease,
Right.
from not using protection. And so I feel like they don't take accountability for shit once it hits the fan, right? So now I'm pregnant and you want to talk about something, oh, I don't want it. So for us as women, we have to be more vigilant in not only asking the questions, but getting to know the person a little bit better before we decide to have unprotected sex with them, unfortunately. And I know, because I'm speaking from experience, that, you know, things happen, but we just have to be better about it. But they need to take more accountability for the role that they play in not only talking us into things or trying to do it, but then trying to shirk their responsibility once shit does hit the fan. It's
Right.
like unbelievable and at an unprecedented high. Like, they are out here doing it, and they'll do it if you let them.
Well, women are going to have to change how they operate, especially in 2025, because you can't just go to the butcher shop.
Not
Yep.
butcher shop.
Or the chop shop, like some people like to call it.
Hmm. Yeah, you are just not going to be able to just pop up and go necessarily like that. So, you have any other questions for Chanel?
No, I think I'm good. You can stay though after I hit stop because I do want to tell you something. But have any other questions?
All right, Chanel, can we just see Scrappy?
Oh yeah, Scrap.
I hear his voice.
Come, Pops. Wait, how
Put
can
him on
can I
the
flip
showing.
this?
Oh, you gotta flip it.
Oh, hold up.
I want to see Scrappy. He is so cute.
Oh,
Is everything okay over there?
He
yeah.
sounds like he's the black version of Egypt.
Look, Pops. Look.
Hello, Scrappy. Hi. He is such a good boy. What are you doing? He's such a good boy.
He was
Such a
waiting.
good boy. I love him. I love him. Okay, so you want her to stay on while we end it? Oh, okay, so do not hang up.
Hi. Yeah.
Thank you guys for tuning in to Healthcare Snitches. Coming to the camera, girl.
Yes, thank you.
Thank you, Chanel, for being here. Thank you for telling your story. Thank you for being fully transparent. Thank you for not making us cry, because if you would have cried, we would have ended up crying. And know your worth, girl. You are such an amazing, smart, beautiful person, and your guy is out there, and you are going to make an amazing mom.
Thank you so much.
Yes. So everybody, thank you for tuning in, and tune in next time to Healthcare Snitches.